Thank you, Rob, and welcome everyone to this virtual space where we keep going, being present together, learning, sharing, and calling each other to act. You know, although we gather now on Zoom, we do meet on the traditional homelands of the Puyallup tribe of Indians, and we acknowledge our debt to their stewardship of this region and to the need for action in addressing the continuing effects of historical trauma. We are also aware of immediate trauma and tragedy. This past Saturday, outside the candy market near 9th and Market in Tacoma, Odessa Easterlin, a woman living homeless who stayed around the market, was killed by a store clerk with a history of mental illness himself, who claimed she was shoplifting. I ask now just for a moment of silence to honor the life of this person who deserved to live and did not deserve to die. It's important to honor the lives of those who suffer on our streets. And in moments like this, it can feel pretty overwhelming and paralyze us sometimes in acting. And to counter that, we gather informally, we gather as organizations, we gather as governmental groups to create plans, to determine benchmarks, to lobby for budgets. We focus on specific interventions to mitigate the consequences of homelessness. Today, we'll learn more about medical respite and discuss how to respond to medical conditions that we may encounter when we're on the streets with folks. We share our resources of good landlords, as well as tarps and water and blankets and garbage bags. Most of all, we pay attention. We celebrate that important moment when we as human beings find ourselves in the presence of other human beings who may be suffering greatly. Whatever else we share, we can recognize each of us as a person with a complicated history and with unrealized dreams and hopes. We can pay attention and listen to the voice that challenges us to act in new ways. As the French philosopher Simone Weil claims, attention, she says, is the rarest and purest form of generosity. I am continuingly delighted at the presence and the generosity of all of you who come when you can, and welcome those of you who are new or returning after some time away. I want to thank everyone also who showed up yesterday or were able to come to our first in-person gathering at the 7 Cs. It was really amazing to see people that I'd only seen in the 2-dimensional space that we're in here. And we plan, and see how it goes, but we plan to continue these on the first Thursday of the month from 4 to 6 at the 7 Cs. So if you have that space available at some time, put it in your calendar as something you might have the ability to do when that seems appropriate for you. So now for our meeting today, and I'll put Simone Weil's little quote in the chat for you because I just find it really helpful. But for today, we have our usual, and you get tired of me saying it, but for those who are new, it's helpful to know what our plans are here. And so we ask people to mute themselves when they're not speaking, so there's no background noise, and also to stop your video if you're doing other activities that might be distracting. We also ask you to use the raise hand function, or if you're on the phone and can't do that, find some other way to get attention. So Rob can keep track of people as they wish to speak. And we also encourage you to use the chat function for any kind of communications that are important to share with people. Your contact information, your group that you're with, particular resources you have or need, or any interesting thoughts or questions you have during the meeting today. And with regard to our norms of behavior with one another, clearly respect for one another's voices is important, making sure we don't take up too much space, but taking up some space when we have something to say, and paying attention to the power dynamics that may be present as we do speak. So I think with that, ask any of you who would like to say, to let us know that you're here, that haven't been here before or haven't introduced yourself before, just to say, raise your hand and then say your name, and if you're associated with an organization, to let us know what that is as well. So I can, okay. See, Rob, if you can, oh, there's Lorene.
Hi, everyone. Lorene Tomich from Elevate Health, and I'm here to tell you a little bit about Medical Respite, give you an update. Glad to be here.
Thank you, Laureen. It's wonderful to have you here. Nicole. I think you're on mute still.
Can you hear me now?
Yes.
We can.
I'm here every week, but I usually just stay quiet and listen. My name is Nicole, and I work for Wellspring Family Services of Tacoma. I work with the TSHAP program, so I'm helping people that are sending referrals from the Pierce County schools through like a McKinney-Vento liaison. So I love this group. It's such wonderful information, and I just appreciate all of you so much. So thanks for letting me join in. And
well, thank you for being here, and we hope to hear more about your program at another time too.
Thank you. Sounds good.
So Erica.
I just would ask that if she could put her referral program into the notes, because we're looking for referrals for our development, for our tiny home community that we're putting together. So it would be a good contact. If she could put that information in the chat, that would be great. Thank you.
Thanks, Erica. And Nicole, you got that request?
Yeah, so all my referrals come from the Tacoma schools. So it has to filter through the school district actually. But Erica, I'll give my contact information, and then anybody else who has any other questions, I'd love to talk about Wellspring and what we offer. We are in King County, expanding this in Snohomish County as well. And like I said, I work for the Pierce County office from home. So there's some kind of nuances to the program, but yeah, I'd love to explain more about that. So I'll put that in there now. Thank you.
Thank you, Nicole.
Yeah, that would be helpful, because we have part of our entity is we have OSPI, we have a private school for our homeless community. So I want to get more information. Thank you.
All right, Rob, I can't see everyone. So if you can see others that may wish to speak.
Yeah, and I don't see anyone else at the moment, but let's give folks just a second and see if anybody else would like to introduce themselves.
Yes, good morning. Levada Kent Napier, just speaking, saying hi. I am still out here homeless, and I'm still trying to network to find a safe place to stay.
Thank you very much, Levada, and I'm hoping that we can find some resources for you. Thanks. Thank you for joining us all these times as well.
And I am not seeing anyone else at the moment.
I believe everyone is recovering from Cinco de Mayo celebration.
That is possible.
I'd like to say a quick thing, if that's okay.
Sure. Yeah.
I'd just like to say thank you for meeting everybody, some of the people in person yesterday. And then I would just like to say thank you for mentioning and having a time of silence for Odessa this morning, because I think it's important to recognize that. So I just wanted to thank everyone for that. And thank you all for this space.
This is Cheryl Hill. I have my hand up, but I'm probably not doing it right.
Oh, okay. Yeah, I'm not seeing anything, but feel free to introduce yourself.
Oh, okay. I have come to your meetings, both Zoom and in person. I'm just a resident that is a shopper and a gambler. And so I shop online to find things for the homeless and for the various charities. And I have explained this back when you were meeting in person, but you've got a lot of new people involved. So I wanted to explain that if in your charity you have something particularly you're looking for, like a projector or a shredder or a TV for one of your residents, just, let your mind go. Go ahead and contact me, And if I don't have it, my thrill is finding it on auction for cheap and providing it to you. So I'll put in the chat, I'll put my contact info in. Thank you.
I got to throw this in that Cheryl means that. She really does do what she says she's doing. She's done a lot of stuff for many of us in the community, and she's a wonderful woman and happy to have her here.
All right, Rob, I think it's back to you.
Okay, well, thank you, everyone. And again, if you feel more comfortable and you'd like to introduce yourself in the chat, please do use that. I love that theory that folks are recovering from Cinco de Mayo, so they're quieter this morning. I apologize ahead of time if my voice is a little rougher than usual. I've, since our last meeting, had quite a cold, and then I went to the Sounders game the other day, and that did something to my voice. So I am recovering. So let's shift to our first regular item, and that is updates from folks about what they are seeing on the streets this week. The purpose of this part of the meeting, excuse me, is to attempt to get a temperature for what has changed this week, discuss particular needs that you've encountered across the county this week, and share any information that you think would be helpful to others who are doing outreach. So I open the floor. Patricia, I see your hand up first.
Hi, good morning. I'm Patricia. I'm like a lived experience advocate. I've gotten multiple calls from people regarding that. If people, I don't know what kind of housing, to be very honest, but if people fall off the wagon in certain houses, they're automatically kicked out. I don't know like the truth to that matter, but I do know one of the individuals I spoke to on the phone, because I got these calls, had never been homeless before, and he struggled with alcoholism and was in a housing and had gotten back to it, but his option was the street. I don't understand that. So I just wanted to bring that as a highlight about like, where do people go when they don't fit the model of the housing they're in? So thank you for letting me share.
Thank you, Patricia. Richard, I see you raising your hand.
I'll jump in on a couple of things. First off, there is another sweep forthcoming at 10th and 11th between MLK and M. I think, correct me if I'm wrong, so it was 2 weeks out, so I think it's the 18th or 20th anyway.
It's May 18th, yeah.
They have posted for a sweep. I'm going to be spending a fair amount of time at that encampment today, thanks to somebody. I'm going to be putting, if you can see this, notice up in addition to the city's notice. I'm going to put some of my post up at the site, and thank you, Lori, for the artwork on that. The other thing that I'll be doing this week, and Rob, I sent you the PDF. I don't know if it'll go onto chat, but as I have installment 3 of our Tent City News, which is a communication that I'll be taking out to people in the encampments today, so that we're connecting with people that are about to be swept with information, with resources and additional information. So those are a couple things. I've got one other, but I'll hold for that for the moment.
Thank you, Richard. And I will drop that PDF in the chat here momentarily after I save it to my computer. But while I do that, others, I see Ed with your hand up.
One of the things that is very evident around the Tacoma area is that we may have as many people with cars as tents that are in an encampment. We're seeing more and more that in these encampments, more and more cars are parked around them that are owned or controlled by the residents of the encampments. So it's really an uptick as far as that goes. And I'm not leading into any discussion of safe parking or anything like that. It's just, it's something that we've seen in the last month or so.
And Rob, if I could lead on into that, I'll try and make it simple as I can. So we went out this week, my wife and I, and did 3 surveys of doing a tent census around town. And I will try to put this in the chat. And the purpose and the goal is to get a comprehensive list of encampments so that when inclement weather arises, we will have the ability to do more effective outreach. So what I am doing with the information I get is sending it to Jeff Rogers. Jeff, I think you're on the call. If you could put your email up, and then I will try to post this in. And I guess the request is if you see encampments that are not on this list, if you forward that information to Jeff, it will help us build the mapping capability to do more effective outreach. So there's a lot of backstory to all that, but that's a short version, and I will try to get this into chat so that you will have the list that I. When I go out, you see a encampment here, there, and otherwise, but when you tally them up and then do the math, we got to, I think it was close to 300 encampments with just a few drives around town. And I'm sure, we only have a small portion of what's really out there. So my request and my hope is that we can direct that information to Jeff and get a better ability to do inclement weather outreach. Thank you.
And I'll just follow that up with, please send a copy to me as well, because we're compiling for other reasons. So thank you.
Thank you for the effort that you're making there, to everyone who's involved. Sally, your hand's up.
Just briefly, in my little church congregation, which is Peace Lutheran Tacoma, 3 people in the last few weeks have gotten such large rent increases that they are going to be forced to move. And one of them with a child has been helped to find additional housing, but the other 2, one of whom is disabled, are really at kind of their wits' end about how to go about this. And so I think we need to be watching for, these are people that are not on the streets yet, but could well be soon. So we need to keep watching this, the rent increase impact.
Yes. Yeah, we need to do everything we can around homelessness prevention and stemming that flow of new people into homelessness. Bob, I see your hand up.
Thank you, Rob. Just in the last 6 or 7 days, we've been put in contact with 3 new families who are living in their cars. 2 of them came over from Tacoma, having been in other neighborhoods there and had been harassed. We're working on getting them a safe parking location here and providing other services. So that's an increase and a flow from Tacoma that we don't normally see. Had a meeting with a business owner in the Uptown area in Gig Harbor a couple days ago. He voiced more concern as that their little business community group at Uptown are starting to see carloads of homeless. They believe they are homeless, but they're coming over for the day and asking for money, approaching people for help. So we're going to get Tacoma Rescue Mission out to see them, but then they're gone in the afternoon, headed back across the bridge. So this is also sort of new day trading, if you will, event for us. That's it.
Yeah, thanks for letting us know about that new development, Bob. Jay, I see your hand up next.
Something else to think about is Seattle's instituted a 72-hour limitation on RV parking on streets. And because of that, I do believe we'll probably see an influx of RVs moving to Pierce through Fife and through Federal Way in the upcoming couple of weeks. So that's something to start keeping an eye out for, is an increase in RV use.
Thank you, Jay. Verna.
The MRC has just finished its pilot project at the 7th Street and Tacoma Avenue site, where we are doing STD prevention, hopefully activities, handing out condoms and information. We've partnered with Tacoma Pierce County Health Department CHWs there, and are going to be continuing forward under our free clinic status with MRC, and continuing the project that way. So we're trying to do something that a lot of other people aren't doing with addressing STDs. So as everybody knows, that's on the rise.
Thank you, Verna, and thank you for that work. And Patricia.
I was going to kind of mimic what Jay was saying. There's some techniques and tactics that are happening within King County that are moving people over into the border of Pierce. And that's why you might see an influx and differences. Thank you.
Yeah, this is why many of us talk about having a regional approach to the issue of homelessness, because borders really do not mean much. So appreciate that information. All right, any last items for what's happening on the streets this week? All right, so if you do have additional information that you would like to share and put it in the chat, that would be a great resource. Again, I know it becomes a broken record, but I want to remind everyone, the chat does get retained and posted on our website after each meeting, and we utilize that as a resource moving forward. So that's a fantastic way to make sure if you share information that it lives on. So let's shift to our first presentation of this morning, and we have a couple of really meaty presentations. So we'll start with Laureen Tomich from Elevate Health, talking about the Pierce County Community Medical Respite Initiative. So Laureen, you have the floor.
Thank you. Is it okay if I share my screen, Rob? Or
it
can
is. Let me give you the ability here. And you should have that ability now.
Okay. I'll try and pull up this presentation, though I'm not seeing it.
It says you started screen sharing, but I'm not seeing the
I don't see it either.
yet.
Right. I'm going to stop sharing. I'll try it again.
Perfect.
I apologize for that.
No problem at all.
It is not showing me the PowerPoint though, is it?
So as an alternative, one thing you could do, there's a couple of options. You could drop that into the chat as a file, and I can open it on my screen and share it that way.
See if I can do this. Otherwise, I can just.
Oh, there you go.
Oh, can you see it? Okay, great.
Yeah,
great.
It just came up.
Okay, so let me get this going here. And someone be my timekeeper, because I did get a little robust about this, and feel free to stop me. I have several slides that I was going to share. I'll go through this kind of quickly, and maybe at the end, feel free to ask questions. I welcome feedback on this. And I'll just say thank you, first of all, to everybody. You guys are a very hard act to follow. I'm always impressed with everything I'm learning. It really enjoyed being on the distribution list, because I do learn a lot from that. So thanks so much. And secondly, we'll just jump in here on medical respite. Someday I hope to come back and go, it's open, but not just yet. It's going to take some time. Some of the things our steering committee has been following that we're really prioritizing right now is still looking for the ownership and operations of who really wants to own this facility. We're socializing this with a lot of potential community partners. We're on the phone talking with them. Several community organizations have expressed interest, but nobody has committed yet. We do have, as far as the provider part of it, for the medical, dental, and behavioral health providers, community health clinics have stepped up, and they're very involved in this initiative. We're searching for a building. We've looked at one early on last summer. It was very small, and the organization decided they didn't want to pursue us using it. And we decided overall, we want to start with something that we can just stay at. So have kind of switched our thinking there. We are working because in order to buy a building, you need some money. So we do have 4.5 million in ARPA funds secured. We've applied through Pierce County Human Services. They took the lead and did a $5 million grant application that we're hoping to hear in May, if we got that or not. Several agencies did letters of support, and we really appreciated that. And Pierce, I should say One Pierce, which is the Community Resiliency Fund of Elevate Health, has said they could offer a $1.5 million capital loan if someone from Pierce County wanted to operate this. So it would be for a local agency, and there'd be an application process. But we're not really, we're still exploring everything. We've had discussions with a group called Turner Impact Capital. We met them a few years ago when we started this medical respite work, and they're a social impact investment firm who started off in education, then moved into the housing world, and then about 3 years ago moved into healthcare. And they've done some medical respites and PACE programs and things like that. So we'll keep researching other options for funds. One thing, the building is one thing to buy. Then we're going to have funds to probably renovate the building. Also, then we need to have operations money. And so I will just mention here, we're tracking the MCO mandate that respite stays be an approved benefit through the for anybody on the Apple Health plans. Let's see, it's May 12th comes the 1115 Medicaid waiver renewal draft, should be out. And we are looking for people to review that. And there's 30 days that you can provide feedback. Elevate Health will hopefully facilitate some discussion groups. So I will send that to someone if you want to distribute it to this group. We welcome feedback. The thing that I'm trying to track is the health-related social needs part of it is Initiative 1. Then we've heard about there's an in lieu of hospitalization. And supposedly in one of those two is where the medical respite funding should be coming from the MCOs. So we'll see how that goes. Haven't heard anything more about that. And then of course, we've been discussing the model a bit, which I'll get to in a little bit here, and wanted to share the timeline. You know, we hope to get this up and running so fast. And realistically, we had quite a brisk discussion about this. Once we find a building that we want to purchase and do all the due diligence around that, do the renovations, we really are looking at 1.5 to 2 years to get that up and running. And then the part of opening the medical respite area would probably be about 6 months after that. So just wanted to share those updates real quick here. And one of the things we are trying to work on is putting together a one-pager, if you want to call it pro forma or whatever. But, you know, we go to people and go, give us money. And they're like, but for what? You know, tell us more. So we are trying to put something together. We will be including what is medical respite. I just like to use that to center people who aren't real familiar with this sort of thing. What I do want to share with you guys is our goal. And our goal is to establish and operationalize a medical respite care facility in Pierce County, recognizing it as a specialty shelter in the matrix of coordinated services supporting the homeless and or those without a supportive or safe environment to receive the care they need to treat their unstable condition. So 2 things about that. When we started this initiative, it was both respites were really hospital initiatives. And I really wanted to flip this to more of a community perspective. And it just worked, like the stars were aligned, that you guys have worked so hard on putting this whole plan together for homeless services that we kind of went, we're part of this. We're going to tuck this underneath that big whole plan. And so that's why we're considering this a specialty shelter in the big plan of homelessness, and kind of expanding a little bit past what medical respite is for most. We really want to expand this. For example, if for federal funds for homelessness, a lot of people can't be couch surfing. That is not a homeless person. But in our definition, especially from the hospital systems, people lose their housing while they're in the hospital, and they've, you know, burned their bridges. People don't want them coming back to couch surf to recuperate. So those are the type of situations we want to be able to support, as well as those who truly don't have a home at all. So our vision is a 50-bed medical respite serving all genders, but we want this co-located in like a 100-bed shelter facility. So 50 beds of respite, 50 beds of true shelter beds. We like that idea because we can really flow if, you know, it's cold nights or whatever and respite isn't full. Why not use those beds for somebody else, you know, whoever needs it. So the flow could be there going back and forth. We would like to have the respite center more in a separate secured area of the shelter, not intermixed with the regular shelter guests, providing short-term residential care. We want to be able to provide daily medical assessments and treatments, wraparound services for all their needs. And we're going to do this in a multiple phased approach. We want to open this as a general shelter. We figure that's most successful because we're going to need all those services. Once the shelter's operation and functional, we're tossing around the idea of maybe 8 beds, maybe more for medical respite patients, see how that goes, and then add additional beds in really a safe and responsible expansion, because we don't want to really start things and then go, oh man, we didn't think this through and it's not successful. And people go, see, I told you it wouldn't work. And we're really trying to avoid that. We're really trying to be very thoughtful in this. I think the last time I was here, I talked about our no wrong door approach for admission. We want this to be for patients to be coming from any place. We plan, again, a phased admission approach. The first thing we're kind of shifting our thinking. Before it was always hospital discharges. Now we're really thinking maybe it's, we look at the homeless that are presenting to the emergency department, but don't require admission because they're going back to the streets to not a place to really recuperate. They go back to the ED, and then finally they're so sick they get admitted. So we're thinking those are the patients we would like to see. Maybe then followed by hospital discharges or outpatient admissions, and then eventually take direct admissions from the street. But knowing that we probably won't have diagnostic equipment, it's probably safest for them to go to the ED, get evaluated and determine that they don't need admission, and then come directly from the ED to us. We really want this to be a collaborative effort between medical providers, and we plan a phased medical, what I'm calling medical outreach. First, the community health clinic docs and providers will care for those in the medical respite program, then expand to the general shelter guests, not just on a special day, but they could come anytime they're not feeling well or want to see a provider. And then ultimately, we really would like to see this facility being housing a primary care clinic that's just open to the public. I'll quickly share the requirements we're looking at. 18 years or older. It needs to be voluntary. They need to be ambulatory, able to mobilize themselves with assistive devices, able to transfer without assistance, independent in managing their activities of daily living, bathing and dressing. Continent of bowel and bladder, we've heard of that is quite an issue for a lot of the providers. That is something they can't manage. But if the person can manage their own collection devices, no problem. We want to make sure that they don't have any infectious condition that requires special isolation. They have to be medically and psychiatrically stable for a group environment and cannot be in active withdrawal or at risk for significant withdrawal. And with that, I'm just going to say this is not a skilled facility. It's not a long-term care facility. It's not a detox center. So I know there's a lot of people out there that need the help, but this isn't going to fit everyone. The services are much what the shelter normally provides. We really are hoping for a building that has individual rooms because we feel that really works better for privacy, serving all the clients. We hope that some of the rooms have ADA accessible. We maybe can't do it all, but some of the rooms have that ability. We want the medical providers on site. We're talking like 8 to 6 might be realistic, 7 days a week. after hours support, we're not too concerned about because we have the on-call docs that we could call, and the providers would be doing on-site visits and treatments. Do basic wound care, diabetic management, respiratory management, definitely oxygen. Before, it was easier to do nebulizers. Now with COVID, there are some requirements around that, so we're not sure. We'll just have to see what's happening with COVID. And of course, care management, transitioning the patient to the next care and level of care and provider. And one of the things, we did meet with the managed care organizations and kind of had a meet and greet, asked a few questions. And one thing they said is they really want to be involved and have a good handoff from the our team to the managed care organization care management team, so that there's good continuity and flow going that way. See, so moving on here, future state, we really want to have nursing assistant care. As I said, we're not looking at this as a skilled facility where we can take care of patients long-term, but we realize that when you get sick, you get weak, and people have good potential for recovery. And those are the ones you just need a little help getting up once in a while when you're not feeling well. If you've ever had foot surgery or knee injury, using crutches and a walker kind of takes some practice. So it would be nice to have some hands-on care to be able to provide to those type of patients. We're also talking about, working with a certified hospice agency to provide some end-of-life support. Love to have physical and occupational therapy on site to help us. And also, we still haven't forgotten about wanting to use this as a training for other clinical professionals. And this is my list of challenges, and I hope it doesn't keep growing, but people are very concerned about the provider staffing. CHC said it's been really hard, and I've heard this from other health teams, trying to recruit providers for any type of work. We're not sure what we're going to do about licensed nursing staff for after hours availability. Is the treatment only going to be able to be provided while the CHC docs are there, or what about those who need something in the middle of the night? Medication management is something we haven't really discussed much about. Most recently, we've talked, there's a lot of pharmacy regulations that we need to follow. So we're still working on that. Definitely need to integrate the medication for opioid use disorder services, behavioral health services, dental services. I'm not too worried about. We can work around that. But then there's going to be those patient issues like the bariatrics who don't qualify, the beds can't handle the weight or something like that. Those with fall risk, impaired cognition, and lots of unknowns yet. So now, what are your questions or comments or ideas?
Perfect. Thank you, Laureen. And if you could take down the slides so we can see each other, then we can move on to that. Patricia, I see your hand up.
Hi, Lauren. Yeah, I can't see her, but this is sort of my lane. I watched the presentation. I would like to rise you up and assist you. I do have some questions or concerns or something in regards to, there's very specific guidelines when it comes to utilizing the terminology medical respite from HUD, JCO, and so forth. So there was a plurality in a lot of the presentation that dismissed that sort of terminology. And then when you include sheltering, there's different ways to approach it, but they fall under like different funding lines. So medical respite is one funding line, but I've been working on terminology calling like medical support, where you can get different like funding to meet the goals that you had on some of the slides. Because on the slides about they have to be ambulatory, they have to be, able to do so and so, that doesn't qualify underneath like the healthcare considerations, insurance and funding for medical respite. So there's like a lot of programming things, but with this said, I am very aligned with multiple programs, including, I don't have the capacity for this week because next week I'm doing the healthcare for the homeless national conference. And they might be, I'm presenting in, anyway, in Bellevue. It's sold out at this time, but there are initiatives, grants, and funding and alignment that could sort of develop this plan a little bit deeper and have it be more effective, because I see 3 different lanes in which there's a plurality in how this could all work. But the one thing that was glaring to me was medical respite terminology with what the capabilities and the capacities were going to be. And that can be switched into like a medical support model, but you can also have, if you do have nursing capacities, it can be medical respite under very strict guidelines. So anyway, you can contact Rob to get a hold of me. I'm have to actually jump off soon to do things for this conference next week, but there I am. Hopefully that's helpful. Thank you. Bye-bye.
It will be, Patricia. Thank you. And I unfortunately can't attend next week. I was hoping to, but I'll put my email in the chat, and maybe you could call me sometime when you're free after the conference.
Sure, I absolutely want to lift you up, but also aligning yourself with certain agencies that can help you realize this vision. Thank you.
Right. Thank you.
Thank you, Patricia. And Janet, you have your hand up.
Yeah, I'll keep it short. This discussion has been around for a long time. It originally started as a possibly just a post-discharge PIC line unit, and very specific to a very specific population. I give Laureen and Elevate Health a ton of credit for listening to us, because we are the ones who see folks on the streets. Our shelters are getting discharges from hospitals in the middle of the night from Uber drivers with oxygen tanks. They're getting people with wheelchairs who've never been in wheelchairs before. So Laureen specifically and Elevate Health has listened to us as we have described what we are seeing on the streets and in our shelters. So please continue to give input, because they are listening. Thank you very much.
Thanks,
Thank you,
Jan.
Janet.
And I'll just add, a lot of what we're doing is going to have to be agreed upon whoever the owner and operator of the shelter is. So it may look totally different by the time we get done, but that's what we're working for.
Perfect. So Laureen, would you be willing to drop your slides in the chat for folks who want to grab it?
Sure. If I can figure out how to do that, Rob.
Yeah, and if you can't, you can always email it to me. Let me put my email in the chat as well.
Okay.
So that we can make it available to folks.
Definitely.
Great. So I want to thank you for the presentation and sharing the progress. And let's shift to our next presentation. And I would like to invite Todd Gunther from the Orting Recovery Cafe. Todd's going to share a little bit of context of what outreach looks like in Orting and the work that he does, but also Todd has quite a personal story that he could share with us as well. So Todd, I give you the floor.
Thank you. Good morning, everyone. As Rob mentioned, my name is Todd, and I am the outreach guy here in Orting. Before I begin, I wanted to add my compliments to Laureen's presentation. I liked, Laureen, how you thinking outside the box. We've all been trying to solve homelessness for what? Going back to the beginning, age of man. So new ideas help when old ideas do not. So good job. So Rob and Garrett invited me to stop by and say hi. I also see some familiar faces on here. There's about 70 cool people wearing super capes. So I'm glad to be amongst everyone. I am currently the outreach guy for an organization called the Recovery Cafe. We have multiple coffee shops around the country where people who have been through the crucible can come and find a non-judgmental and caring heart. My role is to find them. And so I spend a lot of my time slogging through mud and underneath bridges, meeting a whole bunch of interesting folks. Before this position, I helped start a few shelters in the region, including the new tiny home village for homeless veterans in Orting. By way of personal background, I got into homeless services in an interesting way. In my private life, I am a city councilor on my third term. And in my first term, we all hear the phrase, there but for the grace of God go I. Well, it actually happens, and it happened to me. So despite my position, I fell to the streets. I woke up one morning at 7 a.m., birds and sun and all the good things. And by 7 p.m. that night, I was on the streets of Tacoma due to a family tragedy. I lost everything I owned, going all the way back to my childhood. By day, I slept with rats and ate at soup kitchens. And by night, I was on TV approving $1 million checks. So it was quite an experience. And it was some of the darkest days of my life, which I think I'll probably remember forever. Which brings me up to today and what we're doing on the east side. Earlier, I said I felt privileged to become homeless. And I said that because in falling down that dark hole, it allowed me to enter the lives of those clients that we serve, enabled me to walk in their shoes. And what I have found is that it's been very beneficial in outreaching. When I speak to folks in the forest or under a bridge or wherever they may be, their heads pick up when I tell them that I've walked in their shoes. And so I'm able to sit down around them with a campfire and talk about and share different street tips from what I learned on the streets and what they've learned. And we speak the same language on what it's like to survive out there. So that's, I think, a benefit that's come from the days I spent. So how is a cafe outreaching our small part of East Pierce County? For me personally, I'm kind of throwing the table up in the air and asking how can we level everything up. I'm coming to this with new eyes. I've not been in services for the many decades that some of you have been. So I've been looking at everything with new eyes and reviewing our brochures, the blessing bags, our business cards, and finding ways that we can improve that beyond the standard ways of doing things. For example, we recently bought a new button machine right here. So when we've created a dozen designs so far. And so don't be surprised when you start seeing our buttons out there amongst the unhoused. I think they deserve including everybody, I think they deserve some encouragement and some humor in their lives. So I think those buttons will help do that. Also, I've been looking at our business cards. We've all have the standard ones that we've had for years in our own lives. But in my own profession, I've come across a different kind of format that those in the fire departments and police departments and others use, which is a trading card format, where it has their pictures on the front side, and then the back side is a little bit of interesting information about them, maybe a personal message or personal quote. And I think that helps humanize them. And I think it would also help humanize us. So I'm looking into that. I think also a more interesting business card would increase the keep factor. It actually might stay in their pockets for when they need the service versus immediately being thrown away. So that's another thing. On the east side, we don't have the visible homeless population the west side does. So I'm personally going throughout our 130 square mile area and looking under every bridge and inside every park and every forest patch and trying to find where our own unhomed are, and then putting into an application called Mapster. And currently we have 44 already mapped in our area, and that's going forward. In closing, Rob asked me to talk a little bit about how maybe this group could help us out here. I watched an old movie. I don't know if anyone has seen it. It's called Honors. It's from the 1990s, and in it is the late Robin Williams. And they asked him about homelessness in the movie. And Mr. Williams said that homelessness will be solved when we finally see them as people. And in my experience, everything is connected to how the homeless are seen by the public. Our funding, our wraparound services, the political willpower, it all goes back to how the public sees them and how they respond accordingly. So for me, if this coalition has the ability, one thing that it might consider is producing a PSA or a public service announcement to run on TV or social media. You've probably recently seen some PSAs on anti-Asian racism, which shows that population, the other side of them. And I think that kind of idea would help humanize the homeless side as well. As I tell people, the homeless are not just a set of problems to solve, but they also are a set of gifts to be appreciated. And some of the things they've accomplished is the homeless have invented vulcanized rubber, which is on all our car and airplane tires. They invented the school alarm bell system used around the world. They wrote God Bless America by Irving Berlin. They've done an awful lot of stuff. And I think that kind of information can be put into a PSA and broadcast, and maybe it will have escalating benefits throughout. So that's just one thought that came to me. That's all I have. Again, appreciate all the big hearts I've seen. I'm glad to be part of the team. We've only been doing this program here for about 3 months. So I'm new to this. And if anyone has any questions, fire away.
Thank you so much for sharing, Todd. And you mentioned you are aware of 44 sites in the area you've been covering. Is that actually just in the Orting area, or does it spread out?
So we have 130 square miles for the program that we have on the west side for the Navigator program through the courts. And so we cover all the way from Sumner down to Roy, and then from Spanaway on the west side all the way to Buckley on the east. So about 130 square miles. So I'm visiting every freeway underpass, going under them, visiting the parks and finding out where as many of the homeless are. And putting them into that application.
Perfect. And anybody with questions for Todd? I did see Jay asking for your contact information. So I did share your email in the agenda, but your contact information, if you want to put it in the chat, that would be fantastic.
I'll do that.
Anyone else with questions for Todd about what outreach looks like in Orting, or that life experience of that's so unique of being homeless during the day and on a council at night? Bob, I see your hand up.
Yeah, thank you, Rob. Todd, thanks very much. Who is your county council person there?
His name is, gosh, what is his name? It's on the tip of my tongue.
Is it Dave Morrell?
Yes. Yes.
Yeah. And okay. Thank you.
And he's very good counselors too. He comes to meetings and he's always engaged and interested. So
yeah, and he seems to be a very strong supporter of all the programs surrounding homelessness, including safe parking. Thank you. I was thinking it might have been someone else who I received some comments from, another council person at a safe parking meeting, and I just was going to connect with you if it wasn't Dave. So thank you.
You're welcome, sir.
All right. So if anybody else has questions for Todd, and I see Sharon mentioned that she'll reach out to you in the chat, but folks can ask questions in the chat, and Todd, if you can hang out for a few minutes to be able to address those, that would be fantastic. And we can't say enough about appreciating your work out there in the Orting area and you having the willingness to share your story.
Thank you. Thank you, Rob.
Yeah. Thank you so much. So we are behind on our agenda, which is not surprising, but I think I'm going to juggle a couple of things. So let's shift over to do our government updates first, since we're close to 10 o'clock. And then I will move on to a review of last week's breakout conversation with Timothy and our breakout discussion for today. So with that in mind, I see Caleb, you turned your camera on. Are you willing to give updates from the city of Tacoma?
I sure am. Thanks, Rob.
Yeah.
Good to see everyone today. And thanks, Todd, for those words. Quite powerful. I know that this week is particularly hard for a lot of different reasons. And I think everybody and their participation has been well received by me, and one that I will be sharing with my team about how much work still needs to be done and how we all want to be part of the solutions and working with you all. I will mention one thing that was, I always appreciate the mapping that you all want to do on the encampments, and the HEAL team has been trying to do that as well. And so maybe at some point we can get together to compare maps of encampments throughout the city. I know the RVs and cars can move a lot easier, but it's still good to know those folks and where they're at, so we can reach out to them and try to help them as best we can. For that outreach part, this last week, we were able to do about 5 referrals, phone referrals at 4 locations, and had reached out to 25 individuals being contacted, and 9 of those individuals are connected to resources. As you guys know, the Lighthouse did close, and we worked with them on trying to place those folks as best as we could. I think even Gerald's online Brotherhood Rise took some of them as well for a short temporary time. And so I would love to hear other ideas too from folks to see how we can help them. Any other ideas to get those folks out of that temporary shelter into a little bit more of a stable shelter as they're all transitioning. So please let me know. I'm reaching out to the team on that one, because we've kind of exhausted all things on our end to see what we can do. As you guys know, FOB operating base, forward operating base, is supposed to be connected with power today. And this is supposed to be getting intakes as soon as Monday, with Monique, who's already had a list ready to go. And we are excited about that. And now we shift our focus after that to the next, which is with Brotherhood Rise and their site as well. And the team, I'm setting up a team so we can get this moving as fast as we can, and not get into that the same patterns that we did, I think, with the mitigation site at 82nd and Pacific. So a learning experience from us, and great feedback from everyone here too as well.
Thank you, Caleb. And of course, I missed it. I was multitasking, but you did share about the next upcoming sweep as well, right?
Yeah, no, I didn't. I saw Richard already give that. Just a clarification, 9th and 11th from M to MLK is the block radius there, and we'll be out for 2 weeks doing outreach with those folks. I know that's it's been a high priority area. One thing that I've heard from council, and I'm sure we would probably all agree, is that population has been vulnerable, and they're, all homeless populations are very vulnerable to other things as well. And so we're hoping to keep that in mind as we are trying to help those folks too. Teresa, do you have a question for me?
Yeah, I think that I live just a few blocks from where that sweep is going to be. And I think that our neighborhood has been impacted mightily by the sweeps that have already happened. And I gotta say, every time I hear this about how many problems there are, so there has to be a sweep, I recognize that the community that has been built here, the community of people living in cars and tents that has been operating here for quite some time very well, is really suffering because of the influx of people who do not share the same community spirit that these folks do. So I don't know what to say to you, except it's not okay. It's just not okay to say you're trying to mitigate things because it's not working. And so the neighborhoods that are absorbing it, we're just going to keep absorbing more of this, and you keep moving people around. We're trying to keep this neighborhood stable until we can come up with safe place for people to be. And the sweeps are just making it so much harder for us to do that as a community, the whole community, not just the house people.
Yeah, thank you, Teresa. I appreciate that feedback. Thank you.
And then I see Jeffrey. Yeah.
Yeah, Caleb, I kind of want to second that, because that's one of the things I do here when I go into encampments is, you know, if there's another sweep happening, how many people are going to end up here? And, you know, frankly, some of these encampments are pretty stable, and they are very concerned about somebody coming in and upending what they built as a community. You know, not every camp, self-managed camp, is like under 705. They're actually kind of quiet, which is a blessing for all of us. So if we can get some more encampments like 82nd set up, maybe we can get rid of some of these sweeps.
Yeah, Jeffrey, and this is something that I've been able to share with my work in Chicago too as well, where they had plenty of self-managing encampments under the viaducts along those lakeshore drives, or even under the city, that were quiet, that, I mean, very good self-management. You know, they would have schedules of drop off for food, and they had trash pickup, and they were very good at being able to do that. And that model actually does have a lot of benefit for folks that are trying to transition, I think, in terms of getting out from where they are in terms of unstable environments and being, you know, vulnerable populations, and looking towards becoming housed. And that is just the beginning, right? And I think that those do have a place, and I agree with that. And that's something that I've been able to share with council members as I've brought up the type of work that I've been able to do as well. So I hear you.
Thanks, Caleb. And I see Richard with his hand up as well.
Just an observation with L&M, Caleb, and I'm sure you're aware of this, but some people will look at that and see an encampment. What I see is about 7 or 8 encampments. There are little clusters of 3 or 4 tents that are doing quite fine, and are mini communities that are doing the best they can do. And then you go over to 10th and M, and that had been a nice little community, and it's disintegrated quite a bit. What I fail to appreciate is why at the site, and we could go over there right now and buy some meth or heroin, why the heck can't we get an arrest of the people that are doing the drug dealing in open view all day, every day, instead of taking this broad cloth approach where we're disrupting people that are actually fairly stable considering their circumstance. There are some bad actors there, no doubt about it, but they're committing crimes, and that's what needs to be dealt with, in my opinion. Anyway, I would just suggest that the white van, the police know about it, you know about it, I know about it, and we can sit there and watch them deal all day long. I don't understand why we can't get an arrest, because pull that out of the circumstance, and the other stuff going on would diminish quite a bit. Anyway, talking to the choir, I know.
Richard, and what I'm hearing is it seems like we're punishing the folks that are stable within those encampments, and not the folks that are taking advantage of those folks, is what I'm hearing from you. And that's something that I can reach out to the PD as well and understand a little bit about their procedures and what they do, so I can give a more adequate response to that.
Yeah, and I asked them the same question, and they go, we don't know what to do. I mean, it is a problem, but you compare the woman on the corner, and she's been there. This will probably be her 3rd sweep in the last 9 months. Many of the that will be moved, it's going to be their 3rd or 4th dislocation since the Evergreen encampment last fall. And so that's not healthy, but we know who some of the bad actors are. the police know who some of the bad actors are, and why that can be addressed as a criminal rather than, as you just said, punishing everybody for the acts of a few. And that is part of the frustration out there.
Absolutely.
All right. Well, I appreciate you taking all the feedback, Caleb, and appreciate the efforts you're making to kind of implement change going forward. So thank you.
Thank you all. Appreciate it.
All right. So let's shift over to updates from Pierce County Human Services. Jeff, do you have anything for us this week?
Yeah, good morning. We're just focused, the Youth Homeless Demonstration Program grant application is now open. And so we're working very closely with the Continuum of Care Committee and the Youth Action Board to submit a very strong application this year and hope that this is our year to get funding for youth and young adult programs. So there's a lot of attention being put into that application packet. And secondly, the Continuum of Care Committee is really focused heavily right now on working on the Continuum of Care notice of funding that will be coming out sometime early summer, that will be due back to HUD sometime early in the fall, to strengthen that application and address some of the challenges we have within that application to hopefully increase that funding as well. So just some funding things that are going on. We're in the process of finalizing. We just put out a funding opportunity for, we called it the System Enhancement NOFA. It was for CE in shelters, cultural hubs, and a few other things. And we're finalizing that process and should be able to announce next week those funding awards. We had like $3.5 million that were put out. Yeah, sorry, Rob, coordinated entry. Sorry, we get so used to. But so yeah, just working on quite a bit of funding activities is what we're working on. And we leave all of the activities we're doing regarding the comprehensive plan for Garrett to discuss, and Rob, for you to share. I know you and Garrett are working very closely on that. So we'll leave that to you guys to discuss, even though our team is busy working on several components of that. And one last thing, we're hiring a new staff person on the team. It's a data position that we've had on the team for a long time, but the staff that held it, gosh, 4 years ago, maybe, we haven't filled this position. The person left like 1.5 years, maybe 2 years before COVID. So it's been like 4 years ago. So we're in the process of doing interviews now, and hopefully we'll have an additional data staff on the team to support our homeless management information system, or also known as HIMIS, work and all of the data requests that we get. So we're excited to have a new staff on board soon. That's it.
That is good news. Thank you, Jeff. So Valerie, I see information going into the chat that you're sharing. Other updates that you have to share with the group today?
Nothing major today, just lots of amazing events with Tacoma Pro Bono, and we're scheduling some more throughout the community as well. So I'll make sure that y'all have access to all of those. But that new Key Peninsula one is awesome, and it's going to be from 10 to 2. Folks can register through the Community Actions website, and they're going to have all kinds of providers, energy assistance, the Veterans Bureau's there, we're there, Tacoma Pro Bono's there. Everyone that we could really think of is going to be at that event. So if you know anybody in need on the Cape Peninsula, please get that out there.
Perfect. And let's see, let's shift over to updates from the Tacoma Pierce County Health Department. And I need to apologize to Jenny because I think you sent me an email and I didn't respond.
I don't remember what it was about, but just asking for input on this. It's okay.
Yeah.
It's been one of those weeks. Sounds like you've had one of those weeks as well. So no worries. Thanks, and hi everybody. So 7 Seas was awesome. I hope that we do that again. It was for a slightly socially awkward introvert. It was a challenge. I got myself there, and I was so happy I went. It was so odd and wonderful to see people in real life in 3 dimension, as Teresa said, when I saw her last night. But yeah, it was really wonderful. So to all of you who I met in person, it was great to see you. Let's see. Well, you're used to hearing about local COVID data from me.
We update the data every Tuesday. So May 3rd, we got a new data report on cases and hospitalizations, and this probably isn't surprising, but cases continued to rise. Hospitalization rates or hospitalizations are also rising. Unfortunately, it is way down from the last peak that the peak we experienced in January. But still concerning that things are bumping up a little bit. And my data team always stresses that cases are a less accurate way to look at it, but hospitalizations really is more sort of valid way to look at the impact and the increase or the trend. So that is a little bit concerning because the hospitalizations are up by about 40% from the last 7-day period that was measured. So we continue doing all the things, trying to promote vaccination, wearing masks if you're in crowded indoor spaces with, poor ventilation, just being smart, and especially getting boosted. So I talked to some folks last night who gotten their second booster. That's amazing. If you're over 50, you are eligible for a second booster. And should talk to your provider about that. And if anyone's over 12 and immunocompromised. And if you have questions about boosters, let me know, because there is some nuance here in terms of you're technically, if you're in those two groups, you're technically eligible to get a booster 4 months, get a second booster 4 months after your first booster. But if you're in certain other groups of vulnerable groups, you can get it even sooner. So if you have clients or guests, if you're a shelter manager and you want to know more about that, please let me know. What else? We are continuing to do this, what we're calling the on-demand model for getting COVID vaccines out to our shelter guests right now. And we did an exciting little mini event at Hype Center last week. And I think there was a call that someone needed a vaccine. And when our team went out there were six individuals who got vaccinated. So the on-demand model is just basically, instead of setting up clinics where we're out there for several hours, we are taking calls and responding within a day or two to just send a small team out. And it's been working really well so far. So Annie too, who's the lead there, the nurse lead, and I are actually going to go visit folks next week, early next week, and just meet people face to face that we haven't met before, or see people again that we've met, and promote this program a little bit more and answer questions sort of on the ground at the shelter. So hoping we can drum up some more interest. I'm going to share some resources about our Test to Treat program. That's not ours, but that we participate in. That is a way to quickly connect a COVID positive person who fits certain criteria with medications to treat COVID to reduce the risk of severe impact. So if any of you are in a position to raise awareness about that program or to connect people, I will share that with you. And what else? I always think I'm going to be brief, and then I really never am. I'll just share some more links about things. It's Hepatitis Awareness Month. So I'll share a blog post about hepatitis, and I hope to be in my role, I hope to be doing more hepatitis prevention and vaccination work with you all in the coming months. And I will try to share our syphilis flyer. If I cannot, it'd be great if Rob, I could email that to you and you can send it out or attach it to the meeting today. I'm forgetting what Richard called the newsletter. What is it called?
Tacoma Tent News.
Tacoma Tent News. Put our syphilis flyer on there. So that's pretty awesome and exciting. So you can also find that information there. Again, sorry for all that, but any questions for me? And otherwise I'll just drop some things in the chat.
So I see Courtney had a question in the chat about what brand of vaccine is being offered.
What brand of vaccine? Everyone. All our vaccine, do you mean for the on-demand shelter clinics? basically anytime a vaccine team connects with someone who is in need of a vaccine, they will look up their record in the Washington State Immunization System, or if the person has the card that proves what vaccine they had before, if it's a booster, and they will do the appropriate matching. There's a little nuance in terms of the boosters. If you can mix and match, but we have every presentation of vaccine available. So I hope that answers the question.
Thank you for that.
Yeah, anything else?
Not seeing anything else. And if folks do have other questions, chat would be a great resource for that.
Yep, chat, and I'll put my email in the chat as always, so you can reach out to me via email if you like.
Perfect. Thank you, Jenny.
Thanks, everybody.
And I haven't had a chance to notice if anyone from Pierce County Department of Emergency Management is on the call. Let's pause a moment and see if they have anything to share today. And I don't hear anybody, so let's move on to our reshuffled agenda. So why don't we shift over to a review of last week's breakout conversation? And I can share that on screen, Timothy, if you'd like to go through it.
Great, thank you.
Yeah.
So last week we talked about the property at 34th and Pacific. What kind of shelter would we advise the city of Tacoma to locate there? That's eventually going to be permanent housing, but it's available for placement of temporary shelter prior to that, and it's almost 3 acres. So there were some general thoughts around this, and then there were basically 4 categories of recommendations, which I put in here roughly in the order of what I perceive to be the popularity from the various report backs that I summarized. Do RVs or safe parking, do a sanctioned encampment, some version of a tiny house village, and then there was an idea for temporary congregate shelter. Going back up to the general thoughts, I think that a lot of people were seeing this in the context of the sweeps that are going on and the lack of alternatives that are available for people being swept from street encampments, and that there was a sense of urgency to be able to meet that need. And that that accounts for the popularity of RV and safe parking and sanctioned encampments as the sort of like top choices for what to do with that, and the tiny house village thing as well. There was a really interesting comment made. I think I'm remembering that it was Gerald Daniels who said it up in the general thoughts, and it was about, you know, why is it that we have this situation where we're not really meeting this incredibly obvious need? And he talked about how the numbers that the city gathers doesn't really capture the breadth of experience out there that we need to be hearing and learning from. It kind of goes back to Todd's Robin Williams quote about how homelessness will be solved when we finally see them as people. I think it really kind of resonates with that. So moving down into the actual suggestions, the safe parking stuff, that really kind of split into a couple of kind of frames for looking at. One was a KOA style campground site, and there were a few comments that sort of like expanded on what that might look like. And then there were some ideas for really more robust programs focusing on improving the situation of people that are living in RVs. On the sanctioned encampment side, you know, there was a lot of momentum around the idea of doing some sort of sanctioned encampment, and feeling that we really need more of that sort of thing immediately. And, you know, needing to have an answer for people who are asking where they can go before there are more sweeps that are displacing people. And, you know, some version of a tiny house village. I think the thing about that to pull out is that, you know, these can be pretty quick and expeditious to set up. And then there was an idea around how we could do more of a congregate shelter thing at that site short term by perhaps using modular classrooms. And I think that's about it. That's the roundup.
Thank you, Timothy. A lot of good thought went into that, I can tell from the conversation. So appreciate everybody's input on that and your efforts to summarize it all, Timothy.
I'm always happy.
So let's shift into a 10-minute breakout conversation. And as a follow-up to Laureen's presentation around medical respite earlier in today's meeting, we thought we would ask a general question about what do you do when you encounter someone with medical needs on the street? And what we're hoping to do is to get past the simple answers that clearly if somebody has a major medical, life-threatening medical issue, that they'll contact emergency services. But get into some of the practicality of how you, as you do interactions with the unhoused population, if you see somebody with clear medical needs, what you will do. And I see you, Jan.
Laureen has asked specifically for anecdotal stories of folks who have gone from the streets or from shelters or from cars to the emergency room and were not admitted to the hospital. In other words, she's got the data from hospitals on folks who are discharged from hospitals with their condition, and they have a special coding for folks who have no fixed address and who are living unsheltered. So what she needs are stories of folks who've gone to the ER, but were not admitted to the floor. So especially, you know, for you outreach workers or anybody that has direct contact, if you know stories of folks who've gone to urgent cares or emergency rooms, discharged, not admitted to the hospital. Thank you.
Perfect. That's great additional context. So let's go ahead and spend 10 minutes, excuse me, chatting with each other around this topic. I will post the question again as a broadcast to the rooms, but I'm going to send everybody off to rooms of roughly 5 folks. And again, please take some notes and have somebody share those notes in the chat so that Timothy can do his good work with the information afterward. So let's go and we'll come back here at 10:34. So welcome back everybody to the cesspool of something. And I hope everybody had a good conversation. I know it was short. It was so short that we were having a conversation in the non-discussion room that made me lose track of time. So if folks can paste the notes from your breakout conversations into the chat, that's the next key point so that Timothy has some information to work with. So thank you. And now I'm looking at our mess of an agenda. I have a very quick advocacy update that I thought I would share. First things, Tacoma City Council, during their study session on Tuesday at noon, they are, one of the items that they're discussing is called House America or House America. And it is a HUD tool that allows the city to have access to some best practices and technical support from the Department of Housing and Urban Development to work toward a goal that's stated in this potential legislation to create 96 units of new permanent supportive housing in the pipeline by the end of this year. So I plan to be listening to that study session topic. That's one that would have a lot of interest, I think, and cross purposes with the work we do here in the coalition. Tuesday night at the 5 o'clock meeting, it is the community forum opportunity. So that's an opportunity for anybody in the public to comment on anything that the city council has jurisdiction over. So just to make people aware of that opportunity to advocate. Shifting over to the Pierce County Council, as most of you likely know, the county executive vetoed the safe parking ordinance that had been passed by the county council members last Friday, largely on the stated grounds that the addition of civic organizations to the ordinance was too broad and would be outside the normal public process. If you want to continue to support and talk about safe parking, I don't want to steal Jan's thunder, but do think about attending the Safe Sites for All meetings that take place on Mondays at noon. We had quite a conversation about next steps regarding safe parking support at the county level and how to move things forward. The good news for context is that even though the ordinance was vetoed, safe parking is still completely legal at churches because of state legislation and because of the work that Jeffrey Boyce and others did to get that legislation passed a couple of years ago, right, Jeffrey? Yeah, so this does not mean safe parking can't exist. It just limits where it can exist. So any questions about either Tacoma City Council or Pierce County Council items that I can help with right now? All right, not seeing any. Let's shift gears again to Pierce County. And Garrett, do you want to talk about the Pierce County Comprehensive Plan to End Homelessness and the advisory board meeting this afternoon?
Sure. So today at 1 o'clock, there is an advisory board meeting. That's a group put together to basically keep an eye on the county and the community's implementation of the comprehensive plan to end homelessness. I put a link in the chat to the main page about the comprehensive plan, which has a link to the meeting. So yeah, right. You have to go to a link to get to a link, but there we are. This group is still sort of figuring out what it's doing. And today will probably be a bit more of that. So updates on different parts of the implementation of the plan and probably conversation about sort of what their scope ought to be. And a little bit about data and reporting, which is woefully further behind than most people think it ought to be, but there we are. So any folks have questions for me? Again, the meeting's open to the public. There'll be time for public comment.
And just as a reminder, since Maureen Howard has been unable to represent the coalition at these advisory board meetings, although she is weighing in on email, so that's fantastic. But since she's been able to attend, I've been filling in representing the coalition. So if folks have particular concerns or thoughts that they would like to share with me offline, I'd be happy to take those. And I'll put my email in the chat here between now and the end of today's meeting. All right, so let's shift gears. Thank you for that update, Garrett. And shift over to a quick update about Safe Sites for All. Jan?
Yes, I am reporting that Human Services is actively planning coordinated response for inclement weather events. So we're in discussion with Human Services on how to have a countywide uniform response by all members of our county. That is happening. The second thing, I am really pleased that both Todd and Caleb talked about mapping encampments. I expect emails from Safe Sites for All because we need to know where encampments are So thanks for that. And the third thing is, Teresa, are you able to post yes. Okay. The safe parking network, safe parking ordinance was vetoed. One approach we thought we would have is not to draft a letter, but if folks are interested to attend any pertinent committee or council meeting and voice your opinion on safe parking ordinance, the language as it existed or however your heart leads. And we're not going to have a coordinated uniform response. We're going to ask folks to show up and do public comment. And we have talking points that we've talked about, and Teresa will share those talking points, and you could share those or your own with council members at appropriate venues. See you Monday at noon. Thank you.
Thank you, Jan. Any questions for Jan about Safe Sites for All? Yeah, Todd.
Yeah, I'm just going to echo what Janet said. So often when these city councilors are making decisions, nobody in support of the homeless side is ever there. And so they're very often are making very uninformed decisions. So I'm with Janet. And if anyone ever needs me to show up at their council meetings, let me know. I'll be more than happy to give those gentlemen and ladies some stuff to consider.
Thank you, Todd. Teresa, I see your hand up too.
So question for Todd first. Are you saying that at your council meetings, you would be welcoming people from your area to come and talk? Is that?
Oh, absolutely. Yeah.
Because there are some people in this group who are doing a pretty good job of showing up at the Pierce County ones, especially around home housing. And so, yeah, maybe we can get the word out to find people who are constituents of that area. So I just want to pitch again that we did have a success with this vote around safe parking in that we had the majority of the county council approved it. And so I want to remind people that there are some people working really hard in the county. And sometimes when I see something like this fail by just a couple people or in this case, it was one person, the one council member could have shifted it, and then the county executive could have shifted it. I don't think it's a failure in terms of our communication, but I think it's a challenge to us to do a better job of communicating with those individuals and also their constituents. A lot of tails are wagging dogs. So people who are in positions of leadership, who should be the most well-informed people in our communities and aren't always, we can help there. People who are in the communities raising hell because they don't really understand that this is going to make the community safer, we can inform them. I hope the talking points are good. If you have things to add, if you have exceptions to take to it, please be in touch with me. I'm going to put my email in the chat. And these are the first blush, the first brush at making some talking points. So please do give me feedback, give us feedback. And thank you, Jan, for your leadership in this.
Thank you, Teresa. All right, so let's move to the next item in the agenda, and that is any updates from other coalition committees. Anything that you need to share today, Rosemary?
I think the one thing I would say is that one of the things we at the governance work group would like us to do here is apropos of what Teresa was saying, I think, is to celebrate the small victories we have in whatever areas we have them. And so while it didn't get on the agenda as a formal item for today, we're thinking that would be very good for us to do. And the second thing is that with the information Timothy's providing for us in collating our breakouts, we want to use those as a way to reflect every week before the steering committee of things that we should be paying more attention to make either proposals or to bring back to the group for more in-depth conversation. So we want people who are here on the call to recognize that all of the voices that are here, we're trying to make sure that we don't forget them and that we follow up on things that are important to you. Also, I will just say that the Race and Equity Committee will meet, we've decided to meet once a month right now, given everyone else's commitments, and we'll be meeting on the third Thursday of the month from 3 to 4. So I'll send that information to Rob so we can get it on the calendar. But if you're interested in joining that conversation, those are our plans.
Thank you, Rosemary. So, you know, just like every week, this works out. So we now have some time for good trouble announcements. So things that people have that they would like to share that can be good for the larger group here. So anybody with those kinds of good trouble announcements. And I'll kick us off actually. So I wanted to let folks know, on the coalition that next Wednesday will be my last day working with Metropolitan Development Council in my communications role. I am making a shift the following day to begin working doing communications for the Washington Low Income Housing Alliance. So I will be helping out with the communications around advocacy with Housing Alliance. The great news is that will not impact the work that I am doing with this coalition at all. So I will continue to be here as a thorn in people's sides, but I do want to put my best email contact into the chat so that folks have access to that, because my MDC address I won't see those emails starting next Thursday. So that's that. And any other kind of good of the order announcements that folks want to share? Teresa?
So just so you know, Rob, mostly people when they change jobs, they take a week off in between. I just thought you might not be aware.
I have boundary issues. Yeah. And Courtney.
Thank you. I am in the car, so I apologize. That's because of our breakout room. Whole Washington is a single payer healthcare organization. We will be collecting signatures for an initiative to the legislature starting tomorrow. We will be at the Grand Theater from 9 to noon for a viewing of Sicko, and Michael Moore will be attending via video conferencing. So that's exciting. You can pick up petitions, you can sign a petition, you can, anyway. And I think the biggest selling points for everyone is that it covers so much more, including dental, vision, and hearing. And then for those who are the most vulnerable in our communities, it also covers durable medical equipment like crutches or canes, walking assistants, wheelchairs. And it also removes the tiered service paradigm in that every patient would be reimbursed, every provider would be reimbursed for patients at the same rate. So it wouldn't be, I don't take Medicaid because they don't reimburse enough. And so it creates equity in the healthcare system. And so I hope we can garner all of the support from the broader community. Thank you.
Thank you for making us aware of that, Courtney. And Richard, I see your hand waving around.
Excuse me. I have a PDF of the Tacoma Tent News. If anybody is interested in receiving that, just message me and I can get that to you. I have a lot of print that I'll be taking out to encampments, but there's an electronic version available as well. Thank you.
And I think Lori may have emailed that to the list earlier during today's meeting too. So
I did. I sent it out to the whole list.
Yeah, so folks who are on the mailing list should be able to get that way too.
And it is posted in the news section on the coalition website. Upper right
look
corner.
at you.
I know, right?
Yeah, wow.
Thank you.
All right, other items for the good of the order?
Yes, I thought I put my hand up.
Oh, you did the clap icon, so go ahead, Lavana.
I'm sorry.
No problem.
On May 20th, I'm gonna do a fundraiser on the Zydeco Queen at the 1902 MLK location, Unit D. And we're training young people on how to cook outside under a tent and safe with propane. So that's once we do that once a month. So May 20th is our next event. And we're asking donations, but they will get food. If homeless people walk up and they don't have money, they get a fresh cooked meal.
Thank you for that, Lavada. And I don't know if you're on the mailing list, but that might be a good thing to share on the coalition's mailing list as well.
And I don't know how to get on that list.
Here, I'll put a link to the webpage on the pchomeless.org site where you can register to join the list and then post things to that mailing list.
Oh, okay, thank you.
Yeah. Anyone else with items for the good of the order? All right, not seeing anything today. I did want to mention if folks want to provide feedback on today's meeting, I'm of course open to receiving that. Feel free to drop anything in the chat that you think would be helpful. In addition, I wanted to announce that we talked about at the steering committee, and I think actually in the governance committee before that, about adding an item at the end of every week's meeting to celebrate successes. As an organization of a network of individuals, the coalition has actually made quite a bit of progress over the years, and week to week even we have successes that we tend to brush over because far too often I think we think the impact of those successes is not big enough. Well, BS, we need to celebrate them. So let's set aside some time at the end of every meeting for people to be able to share a success story. So I will add that to the agenda going forward, and invite people to reach out and let me know if they would like to share a success story, so that we make sure that we have content for that at the end of every meeting. And I see Shannon's hand up, and then Jeffrey.
Does it have to be a success story about anything?
Well, preferably related to the work that the coalition does, but I think success can be defined a lot of ways. So it doesn't have to be the world was moved, but we want to recognize progress and success. So that's the intent of the section of the meeting.
Okay.
Great, thank you. And Jeffrey.
Well, good morning, everyone. I have permission from Monique Brown to speak about the Veterans Village. Power is supposed to go in today. They're taking their first guests in on Monday, and there's 3 couples in that. So they're going to have, as of Tuesday evening, they're projecting to have all the tents full. That being said, they want to provide 1 hot meal a day for the campers there. And now my church has volunteered to do that once a week, but they are looking for other people and other organizations to help out with this. And Monique also said that the city has asked her to maybe do a second encampment, just like this one. So bravo to FOB, and this camp is finally accepting people. Thank you.
Thank you, Jeffrey, and that is good news to celebrate for sure. Patricia.
I just wanted to thank the coalition for a variety of reasons. As a whole, you, Rob, for sort of your ability to ethically lead, Garrett for helping supply and promoting different avenues to be highlighted. Leading through this crisis, particularly with COVID, was able to set the stage to implement that we're more visible, communicating more effectively, getting the facts out there to think clearly so that people and providers and this whole coalition can relationship build. I don't know where it was said, but it's like shipbuilding for friendship, partnership, sponsorship, and relationship. And I also wanted to lift up the Patients with Lived Experience Coalition and supporting them as a lived experience voice comes forth. That it's part of the answers that you're looking for to have that. And thank you just for personally being a safe space and all those behind me, because honestly, I don't want anybody to go through what I've been through. And that's why I am here as an advocate. Thank you.
Thank you, Patricia. And on that note, I know we have about a minute left in today's meeting, and I actually like to end even earlier, but I see an animated Garrett face on the screen, so I will not end right now.
In our last minute, I picked up the Homeless Coalition t-shirt supply that the Salvation Army was kindly storing for us. So a bunch of folks got Homeless Coalition t-shirts. They're free for the taking at our meet and greet last night. But if you would like your Homeless Coalition t-shirt, you can get a hold of me and I can get it to you somehow. If not at the next meet and greet, then some other way. So thank you.
Perfect. Fantastic. Well, and the shirt looks marvelous, Richard. So you model it well. All right. And there's Garrett holding one up too. So I hope everybody has a good weekend, and I look forward to seeing everyone again next Friday. And that's it for today. If you do have the capacity to hang out and plan next week's meeting, a small group of us will do that, and everyone is welcome. So have a good weekend. Talk to you all next week.